All right, let's get into our first discussion of the day now. Today is World Blood Donor Day. It is a day that advocates for blood donation worldwide, call for more commitment to blood donation to avert needless deaths around the world.
And in Nigeria, only 10% comes from voluntary donors. In this report, Jacqueline Ogo takes a look at the crucial need for more blood donation in Nigeria.
Nigeria's annual blood donation need is 1.8 million pints, but the National Blood Transfusion Service does not get beyond 51,433 pints of blood yearly. This dangerous situation is existing at a time Nigeria is recording the deaths of not less than 26,000 women who bleed ceaselessly after childbirth annually. This has earned Nigeria the third highest maternal mortality rate in the world. In 2016, a UN agency reported over 732 deaths of children in Nigeria. But advocates for blood donation say many of these lives would not have been lost if Nigerians had a stronger culture of periodic blood donation.
It is not just mom, like I mentioned, children who have malaria. One of the highest cause of malaria mortality isn't actually the malaria, it's the anemia from malaria. So children, it's very important for children that there's blood in the system. And when blood does not exist, people will die. There is no other way around it. If you need blood and you can't get blood, you have about 2 hours to live.
The World Health Organization recommends that 100% of blood donation should come from voluntary donors. This is because they are compassionate people who are not likely to lie. Some paid donors who desperately need money could keep away some health details, and peradventure the blood donated is not properly screened, people would have infected blood transfused into them. That's why voluntary blood donation is highly recommended. Ifeoluwa Olokode has been a blood donor since 2010. She says there is nothing to fear if you're healthy.
They only take 1 pint of blood per person. Everybody, I think humans have about 15 pints or 16, more than enough blood in our system. So when you donate 1 pint of blood, you won't even feel it.
Men can give more than women can. So generally men can give 4 times a year, right? So if you're a healthy male, you can give every 3 months. If you're a woman, you can give every 4 months. The reason why is because women bleed more than men because of monthly menstruation, the menstrual cycle. So women can give 3 times a year, men can give 4 times a year.
Doctors say there is no side effect a healthy person gets from donating blood quarterly, and saving lives can never be a bad legacy. Jacqueline Ogo, TVC News, Lagos.
Very interesting there. Well, we have in the studio the founder and CEO of Life Bank, Temi Giwa Tumbosun. Good morning. Thanks for joining us.
Thank you for having me.
And of course, joining us from our Abuja studio is the National Coordinator, National Blood Transfusion Service, Dr. Oluwatoyin Smith. Good morning. Thanks for joining us.
Good morning.
Morning.
All right, let's begin with you, Dr. Oluwatoyin. How important, first off, is it to draw attention to the need to donate blood?
It is very important because, as you know, when we have surgical emergencies, when we have patients with cancers, when we have victims of road traffic accidents and insurgencies, as we have had in the recent past, you do not go about soliciting for blood at that point. You needed to have safe blood units available within the hospital setting for transfusion to these victims and patients. So the blood needs to be available already at the blood bank, screened for blood-borne infections and ready for use.
Okay, let me come to you, Temi, on this. So far, how responsive are Nigerians when it comes to the awareness on donating blood? How are they responding to this?
I think for the most part, people are interested in giving blood. Here's my insights around our culture. I think Nigerians are generally giving people. You can see like call for donations, to give money towards people's healthcare. A lot of people always give, and they always give bigly. So I think generally Nigerians are giving people. I think what has been missing in the last few years is telling people how. Okay. Why you should give blood, why it's so important, and how you can go ahead and do that. And I think that's what's been missing in the conversation around blood donation.
Okay, we'll actually get around that, but let me stay with you. The issue of quality and safety and, of course, availability of blood is major. Only yesterday we were talking earlier about, you know, a young man who fainted, a 17-year-old young man who fainted because he had donated blood twice within a space of 1 week, and not 1 pint of blood, about 6 pints. I don't know how true that is. Talk to us about the issue of safety and, of course, availability. And what
so it's very important that anyone in this system treats donors very safe. It's the first thing you do when you come to give blood is we first test, do you have enough blood yourself? Because it doesn't make any sense for you to give something that you need yourself. Exactly. So I think the story of that young boy is very, very sad and very, very disturbing, because he didn't. By the time you're giving that many pints of blood, you yourself get anemic. So now he needs to, he actually now needs blood. So it doesn't really make sense to do things like that. At a time, you're supposed to give 1 pint of blood, and that should last you for 3 months, or in case of a man, and in case of a woman, 4 months. And the reason why we put those like sort of time, those gap, is because we want to make sure that you're safe and you're actually ready to give blood. Your blood is back to the normal, replenished, so then you can actually give another pint. So it's very important. And when you do it the right way, it's safe for you. It's healthy for you. It's actually, some people are prescribed, you know, letting out blood, because sometimes you can actually have too much blood. So it's very, very safe. Wow. It's Fit Farm compliant, because it removes about 60 calories. So people who are trying to lose weight, giving blood can help you.
That, definitely.
All right, Dr. Smith, let me come to you on this. Our guest in the studio, Timmy, just mentioned something. Sometimes you can have too much blood. What kind of situations can make someone have too much blood sometimes? Talk to us about that.
Oh, well, you have people whose hemoglobin level is higher than normal. And, you know, what we tend to want to do for them is to, you know, shed the load a little bit and encourage them to donate regularly. As has already been said in the studio there, men can donate every 3 months, about 4 times a year, and women 3 times a year, every 4 months. So what we just encourage them to do is to shed the load, so to speak, and donate regularly. That is, they must come every 3 or 4 months, depending on whether they are male or female.
Talk to us a bit, Dr. Smith, if you can, about the ethics of blood donation. Let me still refer you back to the story of the 17-year-old man that fainted after donating blood. The word donation means it is free of charge. But this young man, according to reports, was paid 2,000 naira, and the the person who runs this illegal lab actually, you know, gives the hospitals. He supplies hospitals, and he according to reports, he gets paid 7,000 naira. So talk to us about the ethics on the part of the hospitals who actually would collect this kind of blood from this illegal blood trader or retailer. Thank you.
Yes, well, I wouldn't know which hospital this is, because ideally in a hospital setting, people are invited to the blood banks within the hospital settings to donate. We call them commercial donors, and they do it for a fee, you know, because you find that in the hospital, if you want to attend the antenatal clinic, for instance, they demand a unit of blood from you. So sometimes these women would ask their husbands to donate, and you know they're not really willing. So, but they must bring a pint of blood to the hospital, and this is where the commercial donors thrive. But a hospital that is worth its salt should have, you know, regular clients that do come to donate, and they would do a quick test to determine and screen the blood for, you know, the blood-borne infections, HIV and hepatitis B especially, just to make sure that, yes, this blood is not infected. So this tout, for instance, I really don't know which hospital he works with. It's wrong for a hospital to take blood from someone outside. And even if they do, they are required to screen the blood further. Whatever blood unit he brings, they must screen the blood further for the parameters with which they can. Sometimes they have the equipment, they don't. At MBTS, we make sure that the donor is coming voluntarily. The donor is not remunerated in any way, and he gives freely. Before you donate, he fills a donor registration form within which he fills questions related to his social behavior and his medical history. And then we determine his hemoglobin content. If it is less than 12 grams per deciliter, for instance, he is not eligible to he or she is not eligible to donate. If it is 12 grams per deciliter and above, his weight or her weight is 50 kilograms, then, and there is no active illness, malaria or chronic illness, hypertension, and so on, taken from the history in the form, then the person is eligible to donate. And then we take the blood and screen. Once it is screened, he's counseled post-donation, given refreshment, and comes back later to find out his status. So the action of this particular trader is completely unethical, and the hospital that is accepting the unit from such a person is also practicing unethical practice.
Okay.
I would suggest that hospital be sanctioned, really. The owner of the hospital, I doubt if it is a government-owned hospital.
Okay, we'll talk more about that. Timmy, let me come to you on this. Talk to us about the issue of blood groups. When we used to, in schools, we used to learn that there's blood group O positive, and then A and B, and then AB. But recently we started reading that there's so many different, there are other blood groups. There's even O negative, there's A negative, there's A.
Eligible to he or she is not eligible to donate. If it is 12 grams per deciliter and above, his weight or her weight is 50 kilograms, then, and there is no active illness, malaria or chronic illness, hypertension, and so on, taken from the history in the form, then the person is eligible to donate. And then we take the blood and screen. Once it is screened, he's counseled post-donation, given refreshment, and comes back later to find out his status. So the action of this particular trader is completely unethical, and the hospital that is accepting the unit from such a person is also practicing unethical practice.
Okay.
I would suggest that hospital be sanctioned, really. The owner of the hospital, I doubt if it is a government-owned hospital.
Okay, we'll talk more about that. Timmy, let me come to you on this. Talk to us about the issue of blood groups. When we used to, in schools, we used to learn that there's blood group O positive, and then A and B, and then AB. But recently we started reading that there's so many different, there are other blood groups. There's even O negative, there's A negative, there's AB negative, and all of that.
And then it raises the question of who can donate blood.
So when it comes to compatibility, who can give to who, and who can receive from who, and so on?
So there are eight types of blood group.
Wow.
So the O's and the A's, the B's, and the ABs, and each type has a negative or a positive. So you have O negative and O positive, A negative, A positive, all over like that. So I think generally everybody can give blood. Anyone can give blood, as long as you're healthy, as long as you have enough blood yourself, you can give blood. right? There's some people who have very rare blood types, especially for your community. So in Nigeria, in Africa, people of African descent generally have more O blood types.
Okay.
So the ABs are very rare.
So is that a good or a bad?
No, it's neither good nor bad. Like it's just the reality of how our genetic
It doesn't stop you from giving or receiving.
Exactly, it does not stop you from giving. It just means that we need more of the O's in Nigeria, more of the O positives or O negatives. ABs are very rare. They're the rarest blood type in African, in part of the world. They're very rare. So in those times, we generally tell people with AB blood to wait until there's an emergency to give blood, and we have a system.
Why do they have to wait?
Because it's so rare. There's very rare.
Okay.
So they may not be needing them.
Exactly.
Okay.
Exactly.
Oh.
So because there's so little
demand
percentage.
For
exactly.
Okay.
So
their
the supply is rare.
not.
And because the supply is rare, the demand will be rare as well. So generally you ask them not to give regularly. So you give when there's an emergency. But anyone can give blood.
Okay, that's interesting to know. Let me still stay with you. You were going to tell us about the benefits of donating blood.
Yeah.
You touched on one that's really interesting. Weight loss. That should be very encouraging for a lot of people. But talk to us about all the benefits.
Absolutely.
Really.
I think the most important benefit is you get to save your life.
Yeah.
I come to this work not as a medical person, but as a patient who was in this sort of situation. Maternal mortality is such a significant problem, and the highest cause of maternal mortality in Africa, in the entire world, is something called postpartum hemorrhage. Like I mentioned, a mom gives birth and then she starts bleeding and bleeds and bleeds and bleeds, and then she dies. So it's a huge problem in our country, and giving blood can actually save these moms. It can save children, cancer patients, sickle cell, people with sickle cell, people who are doing kidney dialysis.
Yeah.
It goes on and on and on and on. So the most important benefit of giving blood is saving a life. The second one is, like I mentioned, Fit Farm. So the data shows that by giving 1 pint of blood, you can lose up to 60 calories. So it's really interesting. So if you really want like a nice donut, you can eat the donut and then go give blood, and it doesn't really count.
And then it balances up.
Exactly.
All right, it's interesting for the ladies
I've
to...
heard too that it reduces heart.
It reduces heart
disease,
diseases, types of heart diseases. If you have too much blood in your body, there's a particular name for that condition. Giving blood can help you live longer. And it's just rejuvenating, because when you remove that like old blood, and your body recreates new blood, so it's basically blood. Fresh and rejuvenating yourself. So it's just beneficial. I don't see a downside in giving blood.
Okay, let's come to Dr. Smith here. A question popped up in the studio sometime before we began the program, and the person was saying that it is called blood donation. So donation, by that, it's not being sold.
It's not commercial.
It's not commercial. But when blood is needed in the hospital, it doesn't come for free.
Yes. Blood is a living material, so to speak. Once it's collected, it's collected into a fresh blood bag. There is no reusing here. That connotes some expense. The blood so collected has to be refrigerated at optimal temperatures. What that means is that you must have constant electricity supply, be it NEPA or PHCN or PHCN or diesel. And when you say that, you're talking of diesel. That you must have. Then the consumables used to bleed the donor, they all need to be sterile, aseptic, fresh and new. You must have constant supply. Now, the screening material, the reagents for screening the blood. Each pint of blood at the MBTS is screened for 4 parameters, which I mentioned earlier. They are very expensive. One parameter alone costs 65,000 naira. So you see what it takes to screen this blood. And we have to make sure that that blood, when collected, is utilized within 35 days. the shelf life of each blood pint is short. The shelf life of the screening reagents, which are cold chain dependent, is also short, about 3 months. Everything has to move at a fast pace. And you cannot afford to transfuse expired blood into any patient. So it's this minimal cost, which actually comes to about 37,000 naira, that is being charged, or is the cost. And we now charge at the MBTS 5,000. It is a handling charge or handling fees. So that is what we charge for. And if we don't do that, we will not be able to sustain the service where funding is diminished or is inadequate. We need to be able to fill the gaps. As it were, it is not adequate. 5,000 naira, that is not how much blood is given out anywhere else. It is only given out at the MBTS at 5,000 naira. Going outside, it goes from 6,000 to 10,000. And where you have rare blood groups in need, people are ready to pay up to 50,000 naira.
Yeah. What happens, Dr. Smith, to those people who are indigent, poor Nigerians? A pregnant woman is rushed into the hospital. The hospital insists, oh, there must be blood because that's the norm. What happens to such people? Is there any kind of provision, to ensure that their lives are saved? And then you can talk about, monies later.
No, not now. The only situation where blood is being given out free is with the IDPs in the Northeast. That is where we have made a concession. But usually, our people know how to come about it. We encourage them to come to the MBTS anyway. That is where you get it at the fairest cost. Otherwise, you find that people are ready to pay. When it comes to saving a life, you find that they do it. I mean, that's what we feel, because at the MBTS, sometimes these hospitals access blood from MBTS. They do send relations from these hospitals to the MBTS. But when it gets there, they are rescreening and increasing the cost. So there's a burden for the patients to bear. We don't have a situation where we give out units free, except, as I've mentioned, at the IDP in the Northeast, and then during emergencies. We did that during all the emergencies that we had in the recent past. We were able to give the hospitals units of blood free of charge.
Okay.
Timmy, definitely serious.
Yeah, it's quite serious. But talking about the shelf life of blood, what really happens at the end of 3 months and the blood is not given to anyone? It's destroyed?
You have to discard it. Once blood is expired, you just have to discard it. And I just wanted to sort of mention something about what I think she's completely right. I've looked all over the world. So in the US and in Europe, it's the same thing. It is not the blood that is being sold. It is the services to make the blood safe that gets charged. So we hear, because we have donor drives all the time. We have one coming up on Saturday in Lekki. But we hear this question over and over again. People concerned that I'm giving blood for free, but the patient in the hospital gets to pay for it. But it's really simple. The patient is not paying for the blood. They're paying for the services to ensure the blood is safe.
The process of getting the blood
for them.
safe.
Wouldn't you rather pay a little token to make sure the blood is safe than live with this sort of diseases, than live with HIV, than live with syphilis and hepatitis for the rest of your life? I think that most people will go for paying for a small token just to ensure the blood is safe and ready to use.
Yeah, but then again, there are those who don't, have the money to pay for that. Even the 5,000 that the MBTS, talks about. In the report by Jacqueline Ogo earlier, 1.8 million pints of blood needed in Nigeria, but you have only about 400,000. So how do you close that gap? That's about about 1.4 million.
That's a lot.
Yeah, it is a lot of So generally, the way we've closed the gap in the past has been commercial donors, right? Commercial donors or family replacement donors, right? So that's what we've done in the past. However, we at Life Bank, we are completely dedicated to building a 100% voluntary donation system. We've built, like I mentioned earlier, it is the why that is been missing and the how. The why is because it saves lives.
because it's healthy for you, because there's no downside, right? And the how is so important. The how is, how do you go about doing it? Let's say to the viewers today, I've convinced them to give blood.
Yes.
So what's the next step?
Tell us.
Right? What happens? So we've built an application, a web-based application that anyone can download by going to our website, livebankapp.ng. You go there, you can join our movement of blood donors. You sign up, you tell us a little bit about yourself, and then you can now book appointments using this app to all sorts of blood banks across closest to you. And every 3 months for a man and every 4 months for a woman, we send you a reminder that, by the way, it's time to give blood again. Book your appointment.
Reminder.
Exactly, a soft reminder. So it's absolutely important. And we book appointments for you. We are not a blood bank ourselves, but we work with blood banks, both private blood banks and public blood banks like NBTS, like Luce Blood Bank. So we work with them to make sure that they can get as many voluntary donors as possible. The last bit is we say thank you. And we like to say thank you with small gifts, not by paying, but we give things like a free movie ticket to maybe the newest movie in town. We'll give things like maybe you can get your manicure done if you're a girl and you really love, you know, beauty stuff. So we have small little rewards that we give people.
So what has been the response so far?
Yeah.
It's been really amazing. We've been on this for about 2 years. We've signed up about 5,800 people on our platform, and they're all willing and ready to give blood. So it's important. We want to grow this. We're having a blood drive on Saturday at the Elevation Church in Lekki, and we really think that it's so important that other parts of the community also pitch in to help us really solve this problem. Churches, mosques, just civic community coming together to help us solve this problem. So we're having a blood drive on Saturday.
That's interesting. All right, Dr. Oluwatoyin Smith, does age play a factor when it comes to blood donation? Can an 80-year-old donate? Can a 12-year-old donate?
Yes, the voluntary blood donors fall within the bracket of 18 years to 65, beyond which you can no longer donate.
Okay, that's good to know. But just let us, we have just 1 minute. Someone who donates, is there any particular kind of diet the person should be on to replenish, or someone who wants to give or wants to donate should be on?
Just eat a balanced diet, a good balanced diet. Lots of vegetables, anything that is good and in moderation.
Okay, balanced diet will do it. Temi Giwa Tubosun, founder, CEO, Life Bank, thank you so much for joining us.
Thank you so much.
I do gather that for you it is based on personal experience that you went into this. I hope we'll have another time to talk about that. And Dr. Oluwatoyin Smith, thank you very much for joining us this morning on the show.
All right, let's take a little breather.
Thank you.
Thank you. Let's take a breather and we hand you over to IK for the news update for the time.